Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions on splenomegaly. Let's start. Question number 1. A 54-year-old female presents to your clinic with fever, enlarged lymph nodes, enlarged spleen, and night sweats. Differentiate causes of splenomegaly that are an urgent priority to exclude. A. Lymphomas, leukemias, and myeloproliferative disorders. B. An infection needs to be ruled out. C. Tick-borne Rocky Mountain spotted fever. D. Cirrhosis of liver. E. Thrombocytosis and leukopenia. So, what is very urgent priority to exclude in this clinical presentation? Answer should be A, that is lymphomas, leukemias, and myeloproliferative disorder. We must exclude this in urgent basis in case of enlarged spleen with this presentation. Question number 2. A 13-year-old male child has sickle cell anemia and had a splenectomy because of complication of sickle disease. What is the normal role of spleen in hematopoiesis? It is the main organ for hematopoiesis, not in the 13-year-old male child. It may be a main organ of hematopoiesis during intrauterine life. In this child, it caused hemolysis of red blood cell due to sickle cell. That is a possibility, good possibility. It produces new normocytes useful in preventing sickle cell disease. Is it correct? No. It has no role in the cycle of red blood cell. No, it has role. The spleen cannot produce red blood cell but can destroy them. No. It is also a site of hematopoiesis, so RBC may be produced in the spleen, and it also destroys the RBC. It is a graveyard for RBC. So what is the correct answer? Okay. Correct answer is B. In this child, it caused hemolysis of red blood cells due to sickle cells. B is the answer. Question number 3. A 49-year-old female has had a splenectomy following idiopathic thrombocytopenia. What is the most prominent priority for the treatment of a patient with splenectomy with this history? Okay, so what is the main feature in this patient? Anemia, loss of hematopoiesis, reduced platelet count, increased lymphocyte count, increased vulnerable to infection. Spleen has taken out, and this patient has idiopathic thrombocytopenia, and this patient is more vulnerable to infection. So answer should be E. E is the answer. E. Question number 4. A 16-year-old male defensive lineman for a local high school football team comes in with a sore throat, major fatigue, posterior lymphadenopathy with exudative pharyngeal infection. You perform an EB virus test which is positive. Homecoming is just 2 weeks away. He asks you to give him antibiotics and get him well for practice next week. You examine his abdomen and note his spleen tip with deep inspiration. What is the best response? Okay. So our choices are: come back next week and let me re-examine your abdomen. B. Sideline the student until splenomegaly is completely resolved. C. Treat with amoxicillin for 5 days and check for repeat strep antigen. D. Work up possible Burkitt's lymphoma due to positive Epstein-Barr virus test and splenomegaly. Tell the patient to go home, rest and drink plenty of water, plenty of fluid. So what is the best response for this 16-year-old male with positive EB virus test and enlarged spleen? Answer should be B. Answer should be B. Sideline the student until splenomegaly is completely resolved. So the spleen is vulnerable to rupture in this patient, especially for some type of sports. So our choice is B. Sideline the student until splenomegaly is completely resolved. Okay. Question number 5. A 14-year-old male presents with Hodgkin's disease. He has night sweats, weight loss, and fatigue. In addition to involvement of lymph node regions on both sides of the diaphragm, he also has an enlarged spleen. The bone marrow aspirate is positive for Reed-Steinberg cell. You suggest that the stage of Hodgkin disease falls into the following categories: Stage 2A, Stage 2B, Stage 3A, Stage 3S, Stage 4. What is the choice? Involvement of the lymph node region on both sides of the diaphragm. He also has an enlarged spleen. So what is the choice? Choice should be D. Okay. That is stage 3S. D is the choice. Question number 6. A 29-year-old male presents with sudden onset of severe right upper quadrant abdominal pain. He has no significant medical history and denies recent trauma. On examination, there is tenderness in the left upper quadrant with guarding. Laboratory investigations reveal an elevated white cell count and anemia. CT imaging of the abdomen demonstrates a wedge-shaped hypodense area in the spleen consistent with infarction. So you got the infarction here. Another one is here. This is the spleen. What is the most likely underlying cause of his splenic infarction? Bacterial endocarditis, sickle cell disease, hypercoagulable state, trauma, Hodgkin's disease. What is the answer? Okay. Most likely underlying cause of splenic infarction. Answer should be hypercoagulable state, C. Okay, so C is the answer. Hypercoagulable state. In that condition, there will be chance of infraction. Okay, here's the infraction and the infraction here. Question number 7, a 45-year-old female with a history of cirrhosis of liver secondary to chronic hepatitis C infection, presents to the emergency department with abdominal pain and distension. She reports a recent episode of hematemesis, that is vomiting of blood. On examination, her abdomen is tense and there are signs of ascites, collection of fluid in the peritoneal cavity in the abdomen. Laboratory investigation revealed pancytopenia, that means all type of formed element, RBC, WBC, platelets are decreased, and coagulopathy. Imaging studies demonstrate splenomegaly with evidence of portal hypertension. What is the most likely cause of her splenomegaly? A. Chronic myeloid leukemia. B. Thrombotic thrombocytopenic purpura. C. Alcoholic liver disease. D. Bacterial endocarditis. E. Portal hypertension. Okay. Answer is E. Portal hypertension.